Um, Thank you. And we'll let you know about the training during this talk. Okay, so here we go. Here's Professor Heather Wardle.
Thanks, Caroline. Hi, everybody, and welcome to this final webinar. And thank you for giving up your time to come and be here today. We're delighted to actually have reached the end point of this project, which Caroline and I were just talking about and saying, we wrote the proposal for this just before the COVID pandemic. So this has been 3 years of hard work implementing this project, and we're really happy to be able to share our findings with you. Just to say before I start, this project has been an immense amount of work from a lot of different people. I've got the glory almost of being able to present the final results, but actually it's been Caroline and Kat who are on the call who have really driven this project forward. We've had amazing support and managers at different local authorities across the way. We've had a brilliant engagement from people with lived experience of gambling harms who've helped us co-develop every stage of the project. So just to say, it's a massive team effort, and we thank everyone who's been involved. Just before we get on too much further around, I am trying to, sorry, there we are. Okay, I've now figured out. So sorry, technical issue there with me not being able to work my own laptop, but in any case, we have now resolved that. Just to say, before we go, these are our conflicts of interest for the team. And the main points to note is that at some point, most of the team have received funding from GambleAware. None of the team do research or consultancy services directly for the gambling industry, although obviously GamCare are part of the treatment network, which is funded by GambleAware, and Bet No More have had some small rep funding from microgaming. So just to make those disclosures, that's the team about anything that's related to gambling. This project itself was funded by the National Institute for Health and Care Research under its under the details here, particularly the Research for Social Care programme, and you can see our reference numbers there. And a disclosure that we're required to make is that the views that we're expressing in this webinar are not necessarily those of NIHR or the Department of Health and Social Care, but we are hugely grateful to them for supporting this project and allowing this independent research to be conducted with local authorities. Okay, now that's the admin-y bits over. What I'm going to do in this next 25 minutes or so is give a bit of an overview to this project and what it's about, what we've done and what we've found, and also give you a highlight in terms of some of the new resources that are available, particularly for any of the local authorities who are interested in kind of extending the work that we have done, and particularly learning more about gambling-related harms and the resources that are available to support those. So where did the impetus for this project come from? So this project is really about trying to understand, can local authorities have a role, in particular in relation to social care and adult social care services? Can they have a role in helping to start conversations with about gambling-related harms? Can they have a role in helping signpost people to the support and help that is available for those who are experiencing harms? And what we do know is that there are lots of people out there who experience some kind of difficulty, some kind of harm from gambling, but it is very rare for those people to actually use any of the support that's available within the National Treatment Network. Now, what we've seen over the past few years is back in 2018, the Local Government Association and Public Health England, they really recommended that adult social care is a suitable setting for identifying gambling harms and also to help support people access help and support. And they called specifically for better screening, diagnosis and treatment of gambling-related harms, and very much talks about the role that local authorities can play in that kind of whole systems approach to reducing gambling harms. Now that very much formed the impetus for this project. We spoke with colleagues, particularly at GamCare, who had tried in the past to implement screening for gambling harms with local authorities. And they'd used quite a clinical screening criteria, sets of questions, and it hadn't really gone down very well. People in particular local authority departments didn't really like asking those questions, didn't think it was appropriate, didn't really understand why they were being asked to ask about these kind of things. And yet there is such a comparison by which things like screening for alcohol or drug misuse or tobacco are so embedded within everyday practice, and yet gambling just wasn't. So that very much formed the background as to why we wanted to do this project. The other thing I'll just say is actually this project and being able to report on our findings now is incredibly timely, because for those of you who don't know, there is currently a big proposal on behalf of the UK government to change the way funding for the prevention of gambling harms is provided. And this is going to be in future through a statutory levy, essentially where they're proposing around £1 million, £100 million pounds a year is going to be gathered from the gambling industry and redistributed to prevention, research and treatment. Now, this package of work sits within the kind of prevention paradigm, which means that from the future, there should be more funding available for local authorities to work in this space. But of course, the questions about how that money is going to be distributed are all happening now. There is a consultation and it's open until the 14th of December. So if any of you on the webinar are interested in putting your viewpoints forward, I would really strongly recommend for you to look at that consultation and to respond to it, and to think about, well, you know, how could local authorities, for example, if you were given some of that funding, how could you use that to help prevent gambling harms in your area? The second reason this is timely is that the National Institute for Clinical Excellence has also just released a consultation on clinical guidelines for the treatment of gambling harms, but which also includes recommendations about embedding better screening, introductory questions to try to identify those within different health and social care services who might need better support. So, and if, in fact, actually some of the questions they've suggested in that consultation document very much mirror some of the work that we've been doing. So hopefully, again, some of the findings from our work can go forward into that consultation. So that's the kind of bigger piece. There's some interesting times when it comes to gambling policy prevention, and there's a real opportunity for us to try to capitalize on those changes. Okay, so but going back to this project, what was it we wanted to do? The first thing we wanted to do was really to understand what would an acceptable question for identifying gambling harms amongst individuals and other people, affected others, be from the perspectives of people working within local authorities and their staff. And also, what would a question be that's both robust and acceptable from the perspective of the service users? Because we need both aspects of that to try and test this out. We also really wanted to think about, you know, how could we better improve the training and the guidance that we give to try and get staff to actually deliver this this kind of question in their settings with confidence. And to do that, we obviously wanted to field test actually implementing something like this within 3 English local authorities. We wanted to analyse the data we collected, and we also wanted to try to get some kind of estimate of how much it actually costs local authorities to embed this practice within some of their departments. So the project itself had 3 phases. I'm not going to go through each one of these in too much detail, but first of all, if you're going to try to develop an introductory question with staff based in local authorities, we needed to be sure we had the right kinds of questions that were really capturing the right kinds of harms for people. And so we had a whole range of question development packaging, which I'll go through in a bit more detail. We then had an implementation phase where once we developed those questions, we then tested them in 3 different local authorities. And we collected a whole range of data and did a whole range of follow-up work to try to evaluate that. And that is our 3rd phase, was where both Caroline and Kat really did lots of in-depth process evaluation work with staff users, with service users and with staff in those sites, to really kind of get a handle on how well that process had gone. Okay, so I'm going to give people a bit of a whistle-stop tour in terms of what we actually did on the question development side of things. So, I mean, our first step was to look at what other people have done. When other people in the gambling field have been developing kind of introductory questions that might help signpost people for better support related to gambling-related harms, what kind of questions have they asked? And then we took that as our starting base, and then with a massive amount of support from our lived experience networks, but also service staff users and also adult social care staff as well, we reviewed those questions to try and whittle them down to something that was really useful and specific to the context in which these questions would be asked. And I think that's really important, because these were never intended to be a screening question by which, if you say yes to this question, we are, X% confident that this person is experiencing gambling disorder. It's much more that if people answer this question, we are confident that actually they could benefit from additional support and help relating to gambling, and being able to signpost and have that much more kind of introductory question, introduction conversation around gambling and gambling related harms. So the main considerations that when we were thinking about what kind of question was appropriate for this particular context was, one, we wanted a question that both asked about the types of gambling harms that somebody might have experienced because of their own gambling, but also covered harms that somebody might have experienced because of somebody else's gambling. And that's really important, because we know that someone who experiences gambling disorder typically affects 6 to 7 other people within their close networks. We also needed to really make sure that the types of questions we were proposing, that actually the staff members working in the local authorities actually really felt confident and motivated about asking. And that's where prior attempts to do this had fell down. People didn't really like the questions. They felt they were too clinical. And if staff are not motivated to do it, well, then you fail at the first hurdle. The other consideration was really thinking about making sure that the question that we developed it was flexible. It could be adapted based on the context. So we know that people sometimes are contacting local authorities and adult social care services because they're actually inquiring on behalf of somebody else. So it needed to be able to flex for that situation. And also, we were acutely aware that there is a huge burden being placed on people working in local authorities and social care departments in terms of the information they're collecting and the role and the job that they have to do. So the question had to be short, it had to be succinct, it had to be as clear as possible for the staff asking that, and also for the users responding to it, to enable it to be effective. So they were the primary things that underpinned the decisions that we made relating to the questions we developed. I'm not going to go through this in detail. If anyone is interested in how we actually went about whittling down our potential candidate questions, this is all reported in a journal article that we've already published, and Caroline or Kat can send that out after the meeting. But essentially, where we got to is that we identified 15 potentially introductory questions from the literature that could be used. The main thing we noticed is that very few of them, or if not none of them, were suitable for capturing the experience of harms because of somebody else's gambling. And that was really important to us, that we captured that within our work. What we then did is conducted 2 what we call expert panels, which is essentially we had people with lived experience, people who worked in adult social care services, and some academics who reviewed the list of questions and gave us feedback on what they liked, what they didn't like, what they felt was appropriate, what wasn't appropriate. And we got down to this list of 6 questions here. And you can see the kinds of things that we were looking at. So, do you feel that your gambling or that of someone close to you is affecting your health and well-being? Is it causing you issues? Is it causing you difficulties, etc., etc.? Stress, is it causing you stress or worry? The next stage, and again, this is where working with our people with lived experience was so important, was we then asked people to review the specific question wording and the terminology that we were using and what their feedback was on it. And that was really helpful, because we had feedback like, for example, don't use the word problem, it's stigmatizing. Don't use the word issue, it was seen as outdated. People particularly like the kind of do you feel as a softer opener for the question. Using terms like anxious or stressed was seen to be kind of quite clinical language, and people didn't necessarily always identify with those particular concepts. So we got kind of that sort of feedback on our candidate questions. And from there, we ended up with 3 questions that we then took into further testing, which were these 3 here. So if you or someone close to you gambles, do you feel it's causing you any difficulties? If you or someone close to you gambles, do you feel it's causing you any worries? Do you feel affected by any gambling, either your own or someone else's? And they were the ones that we then took forward to be tested in a large scale survey. Now, just to give you an idea of what we did with this survey, first of all, we had a sample of about 2,000 people, and we wanted to see just what the responses were amongst this sample of 2,000 people. How many people, when you ask them these questions, actually endorse them? And what you can see here in the orange bars are that they're the responses to how many people said that they felt that their gambling had affected them, or their gambling or that of somebody else's had affected them. And in the kind of pale green bars are the results for those who said that they were worried. Now, you can see there's a big difference between the two. And that's to be expected, because actually the worried and affected questions were specifically chosen because they represent sort of slightly different points on the spectrum of intervention. Being worried is a much gentler but more inclusive question. It's almost like the starting point of, I don't necessarily might have experienced very severe harms, but I'm experiencing something that is causing me concern. And these people can still benefit from intervention and signposting for prevention and help and support. The affected question is obviously it's much more tangible. I feel like I have been affected in some way by somebody's gambling. So it's right that you can see that there are differences in estimates there. Again, this has all been written up in a prior study, so I'm not going to spend too much time on this, but just to say, we then tested how well these questions performed in terms of their sensitivity and specificity, and they performed really, really well in terms of specificity. So essentially, if you are a person who does not have a very severe gambling problem, you do not endorse these questions. They performed slightly less well, but still quite reassuring around sensitivity. So essentially, of the people who endorse these questions, around half, particularly on the affected and the worried questions, actually had a problem gambling severity index score of 8 or more, meaning that they experienced the highest level of severity of gambling harms when we measured it according to a different instrument. So essentially, we are pretty confident that half of the people who say, yes, I'm worried, or yes, I'm affected because of their own gambling, actually are, when you compare it against a screening criteria, actually really are experiencing the most severe harms. So from that, we were able to say, right, well, we're going to take forward 2 questions. Which ones are we going to take forward to actually test in the local authorities? And it was these 2. So it was the worried question and the affected question. Okay. Just to move on slightly is, so now that we've identified our 2 questions that we were interested in, and we wanted to test, of course, a big challenge for us was actually training the staff in our sites and our local authorities to actually be motivated and feel confident to deliver these questions. Because so often people working in different contexts, they're not aware of gambling harms. They may not have come across this as a particular issue or concept before. And we really needed people to understand what gambling harms are, understand that they can affect anybody, understand that you don't have to gamble yourself to be affected by gambling, and also understand that there is help and support out there and that it is underutilized and that local authorities have a role in helping change that situation. So the training that was produced, and again, that was produced in consultation with people with lived experience, but also with some staff from local authorities, was really focused on those key concepts. And it was also, I mean, pragmatically, the training, we were advised not to make the training go over an hour, because that was about as much time as people from local authority settings could give to this particular training. And we had to be quite focused on those particular areas. But what it does mean is, having developed this training for people working within local authorities, we now have a whole ream of resources available to people. So there is a guidance document and there is a training video, and Kat and Caroline can correct me if I'm wrong, but I think the training video itself is now down to about a 30-minute segment. So it's very much, it's a good primer on some of these issues. It's not exhaustive, but it's certainly a primer in terms of understanding the nature and the severity of gambling harms. Okay, so that is a whistle-stop tour of how we got to actually the main bulk of what I want to speak about, which is the actual implementation of this in local authority settings. So what we did was we recruited 3 different local authorities with a different number of staff. And over the course of, I think it took about a year in total, the staff in different departments went about asking the question to the service users that they encountered. And you can just see here, this is a very big summary of a lot of detail. And everyone was asked to well, first of all, during the trial period, ask the question to everybody they encountered, and to then record the outcomes of that encounter in an Excel spreadsheet, so that we could see how many people were asked the question, how many people endorsed the question, and also what happened next to those people. And you can see that they were embedded in different types of services. So in site 1, it was in the single point of access. In site 2, it was the questions were administered across different types of services, so including the learning disability and the health and the wellbeing and debt service, and so on. So in terms of evaluation, what tended to happen was that people would ask the first question for about 6 weeks or maybe 2 months. And then after a period of time, they would then they would change and ask the next question. So they would either start with worried, then ask the affected question, or go vice versa. And that was to help us try to see whether there was a preference for one question over another. As I mentioned, Caroline and Kat have done a ferocious amount of follow-up work, doing one-to-one interviews with service users to understand from their perspective, how did they feel about being asked these questions when they were contacting these different agencies, but also how did the staff feel about administering these questions. And what our emerging findings suggest is that certainly there is, with the local authorities we worked with in this pilot, managers were really keen to support this, really saw that gambling harms and tackling gambling harms was part of their remit, and really understood that there was a role for them to play. The staff and the service users that we spoke with, they did agree with that, but they're also perhaps to a slightly lesser extent to the managers themselves. Now, when we came to find out about how people felt about being asked this question, actually the service users we spoke to really thought that these questions made sense for them to be asked, and they were acceptable to them. And actually the staff as well who asked these questions found that on the whole they could understand why it was acceptable to be asking service users these questions. There was some variance in this though, particularly those members of staff who were at the single point of access. It was clear that they felt more uncomfortable about asking people who were contacting them about gambling harms, whereas where local authorities had embedded it within learning disabilities or welfare support and financial support, or sort of debt and welfare support, there seemed to be less reticence from those staff members about asking this question. The other thing we should say is that although, I mean, we had with the managers in the local authorities in this field trial, they worked really hard, and the staff worked really hard as well. We did struggle to get people to record exactly how many times they asked this question, exactly how many times they people responded to it, and also what the response was. And our kind of impression was that some members of staff felt that they were uncomfortable asking the question, so they just didn't. Some members of staff only asked clients that they felt could match a sort of a risk profile that they had envisaged for themselves, or those who might be at higher risk. And there wasn't perhaps an appreciation of just how important it was for us to record that data. But of course, that has to be taken in the context of we're absolutely aware that the people taking part in this pilot were doing a ferocious amount of work and have a huge burden on them. So we can understand why that happened. There's also a slightly odd thing in that because we were recording data and this was a research project, we had to ask people's consent to answer the question, because ethically we were required to do so. And again, that could have interrupted the flow of how these questions were administered within these settings. But what we do have is some really good feedback and guidance on this. So, as I said, we did have a really positive reception from managers, and you can see here from the quotes that people were engaging with this. Some of the staff that we spoke to, really appreciated the training that we're given. They said they hadn't really given this much thought before, and the resources were really engaging. So that was positive. And then questions here about sort of service users and finding it acceptable as well, and being welcoming to having this conversation. So one of the things, however, when we've been reflecting back on this this question of how do you actually implement this in a way that's efficient and effective, and bearing in mind that we are starting off, this hasn't been done before, this is our starting point. We spoke with people who were part of our staff members who were part of our trial, and there was a lot of support for people who are working in debt and welfare teams saying, you know what, I can completely see how asking about gambling harms is completely relevant in that context. Or the multi-agency safeguarding team, again, they said, look, if we're talking about finances, we can see how gambling fits within that remit. Again, and it was a similar situation with those working in learning development teams as well. For those working kind of more in the single point of access teams, there was a bit more kind of reticence around asking these kinds of questions. And particularly, I remember one staff member said, it felt really awkward to them to be asking about gambling harms when somebody was ringing up and they just wanted a grab rail. So you can kind of see the context where it might be more difficult, and these questions as an initial instance may or may not be as applicable in certain departments. So where did we find some barriers to implementation? Well, certainly when we talk to people about how well this process had gone or otherwise, one of the big things that was brought up was around kind of competing priorities and workloads. So in our research, we were asking people to, with the exception of one site, to volunteer and to ask this question on a voluntary basis. Now, of course, we asked everyone saying, during this point of time, everyone you speak to, we would like you to ask this question, but it wasn't made part of the mandatory process. And quite often when we spoke with staff members, they were saying, well, look, if I'm dealing with somebody in crisis, I don't have the time to be able to delve into this, or there may be other extenuating circumstances, which means that I'm not giving this as much priority as I am to other things. There was that issue again, so that kind of relates into relevance. We also had some specific issues around kind of management changes during the project. So where we started off with a really engaged manager, actually, if they moved on and perhaps the next manager had different priorities on the things that they wanted to focus on, we found that we had more challenges in getting this question asked and administered within the different local authority contexts. And there was also just this issue around stigma as well, and kind of saying, as you can see from the quote here, someone saying, I'm really happy to talk about incontinence and all those kind of things, but you start asking about gambling, and people start to feel quite quickly out of their depth. And again, that speaks to the level of stigma that is still attached to gambling behaviours and to the experience of gambling harms more broadly in the population. So where did we do better? I think certainly our experience was that local authorities fared slightly better when they made the questions mandatory and put it within their electronic recording systems. So people were more likely to ask this question if it was a mandatory part of their process. Now, we weren't able to do that in all local authorities, but we were in this one particular local authority. Having said that, I would say that there were still ways around for people administering this question, and that related to getting consent to ask it. So actually what we found is when it was put in as part of the mandatory system, only 6% of people actually gave consent to answer that question. So we still have an issue there. However, particularly where managers were very supportive and were encouraging of staff and embedding it is within practice, that definitely helped with the implementation. As we've said, sort of staff roles which take a more holistic approach here to implement this better, but also where people could see there was a resonance between gambling harms and their workload portfolio. Other suggestions were that actually it's the best placement of asking these kind of questions is towards the end of an assessment, once you've got a bit of a rapport, and developing it that way. And also that if you have a champion who's embedded within your local authority, whose job it is to go around and say, look, everyone, this is so important, this is what we need to do, that would really benefit from, or really help the implementation of these questions in local authorities too. So just very quickly, and I realise actually perhaps I should have given this data earlier, but within our 3 local authorities, how many people actually were asked the question? So we were across the 3 sites, 150 people were asked the worried question, and 6 of them, that's 4%, said they were worried. 197 were asked the affected question, and 15, that's 7.6%, said that they were affected. And from that, 9 people were then given further brief intervention information, and another 4 people were referred for further support. Now, I appreciate those statistics do not look particularly compelling. But when we think about it in a different way, we have estimates of between 7 to 7.5 to 4% of service users saying that they're worried about their gambling or they're affected by their gambling. Now that is much, much higher than the estimates we find in the general population, whereby people will say it's about 1% of people may have a problem gambling severity index score of 8 or more, indicating they're experiencing the greatest risk. So it does give some evidence that this is a good location for trying to help people who are worried and affected. But we were disappointed, to be honest, at the question that the data wasn't recorded more in terms of how many people we got that information back on. Finally, and very quickly, because I realise we're running out of time, and I can see there's lots of questions coming on. What we wanted to do was to try and assess, well, how much does it actually cost local authorities to implement these questions? And we had some data to do that. And so what we found is that essentially going through the training program, which was that kind of 1 hour program, that cost about £115 per staff member. And the estimated cost of identifying somebody affected by gambling harms in terms of the additional time it takes to then have that conversation with that person identified and do the relevant signposting, we estimate to be about an additional £27 per local per person affected. And these are the kinds of data that they're very rough and ready, and we would have liked them to be built on perhaps greater data. But when we're thinking about, how does the statutory levy money get spent on prevention, if local authorities are wanting to embed something like this in their practices, you at least have a bit of a guide of how much staff time it's actually going to take and how much funding and resources might be needed. So at the end of all of this, as I said, we tested 2 questions. The idea when we started was, to try to generate definitively which question ought to be asked. Actually, the issues that we found were much more about the implementation, much more about the system. The 2 questions that we tested actually both performed equally well. Service users seemed to find it acceptable to be asked either of these. And really, we couldn't choose between them based on the data that we generated. So our recommendation is to choose whichever of these 2 the staff feel most comfortable with, and also best suits the needs of the service area in which these questions are being embedded. I also think it's worth reflecting on, at what point in the prevention journey are you wanting to influence people? If you're wanting something that's a bit gentler, a bit wider, then worries is the question to go to. If you're thinking, actually, I would prefer to have a bit more sense that these people are actually had some kind of experience of negative outcomes, then you would think about using the affected question. So our final recommendations really are, it's acceptable to use those questions to both staff and to service users. They both perform pretty well. Our main recommendations about how to improve the implementation of actually asking these questions in a local authority context. So we absolutely need to make sure that there is management support and that there is training that happens for the staff, so they really understand why it is so important to ask these questions going forward. We think really there's thinking that around making sure there's a case for joined up working for affected service users, so that kind of coming back to that whole service that whole systems approach. And consider appointing a gambling harm sort of champions lead, someone who can really work with the people in the departments to reinforce and embed that message of why are we doing this? Why is it so necessary? And why it's important to continue doing this. Also, that champions lead could work on debunking myths, for example, because in a few cases we had instances where people said things like, well, I didn't think it was appropriate to ask somebody these gambling harms questions because they were older or because they were from a certain minority ethnic group. Now, harms can affect anybody, so therefore they should be asked of anybody. It's called the hidden addiction for a reason. So again, if there is somebody who can champion this approach with service staff, that would be incredibly helpful in terms of improving the efficacy of the implementation. Really useful comments around actually placing it towards the end of the assessment, build up your rapport, and also embedding the question as a mandatory question. I mean, I think that's where we fell over, certainly with our pilot trial, was that it wasn't always mandatory. When it's not mandatory and people have got very heavy workloads, people choose not to engage in those questions. So if you are serious about tackling gambling harms in your local authority, it really needs to be asked on a mandatory basis. I'm going to stop there because we are rapidly running out of time, but just to give a quick recap here of the research team who made this possible. And here is a listing of the research outputs that we've already published. And I'm sure Caroline and Kat will be able to send links to those for anyone who's interested in finding out more. Thank you.
Right, thank you, Heather. That was fantastic. Really interesting. And yes, we've put in the chat the links to our website, which has got the training on it. Now, one of the questions in the chat was, how confident are we in the training? And just to say, yes, part of the study was developing this and testing it out. So it was developed with people with lived experience and also with GamCare, who are the UK's largest gambling support service for people affected by gamblers themselves and affected others. So the researchers, that people in the local authorities and people with lived experience and us were all involved in developing this. And we asked people afterwards what they thought. And, you know, generally we had really good feedback, and people said they did feel more motivated to ask the question afterwards. They felt more confident about knowing who to signpost people to. That was the main thing. And they felt more motivated as well. Also, we did, in a couple of the training sessions, we did ask someone with lived experience to come to the training as well. People really enjoyed that and found it useful, and felt that they learned a lot from actually speaking to someone who'd experienced it. So I don't know if a manager was arranging training, that might be something they could consider as well, working with their local gambling sports agencies. Now, other questions. Someone's mentioned right at the start about drugs and alcohol. Unless anyone's got any other questions about the training. So we are fairly confident that this does cover a lot of bases that people wanted addressed. One of the first questions then that was in the questions was about whereabouts where you should embed the question, especially when you're not asking drugs and alcohol standard. And people did talk quite a lot about strengths-based approaches and, you know, not actually asking about things if they're not brought up. So again, that's you know, that's something for managers really to think about, as whereabouts they'd actually put it in the electronic notes, and where it best fits with other things being recorded. I don't know if anyone wants to say anything about that. And in terms of the questions, both the questions were useful. One of the questions said that affected might be more useful for bringing up things like resentment and depression and anxiety. And that's why in the end we went with both the questions, because we felt it really does depend, you know, which group of service users you're working with and how what sort of questions you're asking at that time. You know, if it's an annual review or something, you can go more in depth. But in other cases, for example, adult safeguarding, it might not really be appropriate to ask, oh, do you feel a bit worried about anything? It's too casual if it is a serious case. So that's why I went with both the questions in the end. And then talking about... Yes.
Sorry, Caroline, can I just pick up on a question that Graham Ainsley's, because it's about the questions. So yes, so Graham's just double checking the question wording, because I was wondering if anyone who was going to be eagle-eyed to notice this, and I meant to mention it, but I was running out of time. Yeah, we did slightly alter the recommended question wording on the worried question after the evaluation of the test in local authorities. And that's because in one local authority, the original wording, which was, is your own gambling or that of someone else's causing you oh no, it was if you or someone close to you gambles, do you feel it's causing you worries? It was taken to be kind of like a hypothetical. It's like some people were interpreting this as kind of, if somebody gambled, would you be worried about it? And it only became clear when we were getting the data back and we're like, okay, this data is looking mad. It doesn't conform to any of our expectations. And we kind of got to the bottom of what it was. So we then have rephrased that question to be much more specific, and take away that potential confusion for someone to actually interpret it as a hypothetical. So the question wording that was on the final slide is the final recommended one, and that's the one that will be going into our final recommended reports. But again, we can clarify all of this when we send out the email from the after the webinar.
Thanks, Heather. That's a very important point to clarify there. Yeah, another question we've got about is family approach. Have family approach been considered? And I think maybe that might be the next area we could move on to for looking at this in terms of research, because we're wondering how appropriate those questions would be if you're working in children's services. They wouldn't be quite right. So, but on the other hand, we've had a lot of feedback that it is children who are being affected by this in terms of poverty and all the rest of it. So definitely something to look at in the future. In terms of recording, if someone else was affected, it was affected other or the individual themselves, yes, we did do that as part of this study. And yeah, we would recommend if that was being recorded by local authorities, we did say, was it someone else? Was it the affected other? Was it the individual? Was it both? So in some cases it might be both. So that or did they not agree to answer the question, which would be useful. So those were the responses that we had in our drop-down menu, basically. Now there's some questions here about normalization and stigma, and someone else I noticed has said, did we get this pushback that really it's people's personal choice? Well, I think that was a bit of, maybe people didn't say that so much to our faces, but maybe that was what they were thinking, that it basically it's not a massive issue and why are you asking about it? But I suppose, and would this normalize gambling? It seems that the question is, would that be worse if it's normalizing gambling, asking this question? But in a way, we don't think so. We think it's better to normalize asking the question and normalize the fact that people are harmed by it. So we found that's all about public health approach, and really this is probably just the way forward. Now really with acceptance, about general acceptance more in society about heightened suicide risk and all the other harms that gambling can cause. So any other questions you two would like to answer?
I was going to say that there's a question here about it's just a process question. So yeah, what happened when people replied yes to one of those questions? Was it instant referral or was it further screening questions? So it wasn't further screening questions. It was then having a further conversation about gambling, and making people aware of the sources of help and support available to them. Particularly drawing on the resources of the National Gambling Treatment Network. So that's both the helpline that's available 24 hours a day, also making people aware about NHS provision, and the GamCare provision that's across the network as well. And again, there was another question further down the line, which was saying, do you have links into the NHS treatment clinics as well? And it was, we tried to give advice to the people that we trained that said, these are the different levels of support that are available. It was very difficult to be too prescriptive about that, because obviously it's someone's personal judgment in a conversation that they're having. If somebody just rings up and says, a woman says, yes, I'm a little bit worried, that's probably not a referral into the NHS clinic, for example, but it could be a referral into, well, actually what you need to do is maybe go and speak to somebody on the helpline or on the online helpline as well, to get some further advice and support. And we did try, and you'll see in the training program and also in the guidance notes, we've sort of tried to help people kind of triage through that decision making, but actually that is something where it is slightly dependent on the context and the conversations that people are having in that moment in time. Caroline and Kat, I don't know if that was something you kind of got more of a sense of with any of the interviews, follow-up interviews you did with service users about how they felt that went.
Nothing to add really to what you just said. No, sorry.
Okay.
There was just a question that I'm not sure if we answered this one from Ian Sandford about DNA services. Ian, I'm assuming you mean drug and alcohol services, just from reading the rest of the question, but if not, then let me know.
Yes.
Thank you. And he's just asked whether the screening would work there as well as what we've piloted. There's already been some trials of that done and published, so you can read about those, and that they have worked quite well. Like you said, there's a high prevalence between the different between gambling harms and drug and alcohol use. If I've put a link to our other paper in the chat, which is our scoping review, which looked at other areas where screening questions have been asked. So if you read that, that gives you some idea of some of the other services that it's been asking, and drug and alcohol services are quite a common one, as well as in sort of prison and things like that.
Great, thanks very much.
No worries. I'll just have a see if we've missed any others.
And that would be maybe a future research area to test out these questions in different areas would be of interest. But obviously we think, the more places ask the question, the better. So it will be interesting to try asking as many different areas.
There's a couple of questions here. One from Mark Conway's just saying conversation starters are only useful if staff are able to engage effectively in conversation in the conversations that followed. And I mean, that was really what we were trying to do with the training, was to get people to feel confident that they started that conversation, they knew where they were going to and what was available. Now, the evaluation of the training did say, the staff who went through that said that they felt more confident and engaged to be able to have those conversations. And certainly throughout the whole project, when we kept going back to the service staff users, they reported that they felt confident. I think whether that's how that confidence then translated in practice, particularly if you were talking to people with more complex needs, is uncertain. And that's where I think our recommendations about having, it's not just like you can train somebody for an hour and then go, right, that's it, they're done. They're going to be able to then go and implement this. It needs to be embedded much more systematically through the kind of the practice of the unit. And that's where our thoughts around having a champion who can go and kind of refresh people's confidence and support them in-house would seem to us to be a kind of a vital point of connection if we're going to try to embed this more into some of these local authority members of staff, or like local authority departments rather. That brings me back to that question, though, of course, of funding, which is why I keep mentioning the statutory levy consultation, because actually you could see a case for having a prevention piece by which you actually fund people to be these gambling harm champions and to trial that in different local authorities and to try and get that engagement and that confidence up amongst members of staff. That would be a really interesting kind of next step approach from this project, I think.
And following on from that, Martin, that's a really good comment about tackling gambling harm as being part of a whole systems approach, and that do they treat it as a compulsive gambling as a gross misconduct or support back to recovery? I mean, that's very important. And within this study, we did have staff who were tasked with asking the question who did actually say, this is triggering, I find this triggering my past or current issues, and didn't want to take part because of that. So obviously you do have to be mindful that it's not just service users who are affected. Wesley, did I see your hand up?
Yeah, it's just that I'm into this chat thing, sorry about that. But something just came to mind is that where you go to dissemination the information to apart from the local authorities. Dissemination apart from the local authorities. Dissemination.
Oh, for this study?
Yeah.
Well, Heather, do you want to answer that in terms of feeding into these NICE guidelines and the levy?
Yeah.
Got consultation out at the moment as well, I see. So,
yes, I mean at the minute it's just consultation-tastic. So as I said, the statutory levy consultation closes on December 14th. Now that's the form of an online survey to specific questions, but there it is quite open, particularly around prevention. Like, so who should hold the prevention budget? Where should the funding go to? Who should have primary responsibility for prevention? So it feels to me there's a real opportunity for local authorities to respond and give their viewpoints on that. So again, we can circulate that link so that people know where to find that information and to complete that. Equally, it's the same with the NICE consultation. I can't remember when that closes. I think that might be the end of November, but we can circulate that link as well.
Thank you. Yeah, brilliant. Brilliant.
Now, we've got some great questions left in the chat about how do we help people in the SPA who see gambling as part of their daily life? And I think, yep, it's all about signposting, because there are support charities who really do help people more in a peer support long-term way. And we had quite a few comments about this, especially with learning disabilities teams. But really, I think, yes, we're coming to 1:30 now, so probably we are coming to the end. But if anyone wants to talk about this any further, or just email any of us, and we'll be very helpful. We're very pleased to get in touch. And yes, please do access the training and all the guidance that's online. So I think we'll bring it to a close there. But thank you very much, everyone, and thanks for coming.
Thank you. Bye.
Thank you.
Bye.
Thank you.
Bye. Thanks to Heather.